Now, you get a lot of patients, you say, that they haven't been to the dentist in 10 or 15 years, and their teeth are loose. You say they're bleeding, bad breath, and all these other things, and they have gum disease.
Yes.
So can your gums be too bad for dental implants where they won't stay?
No, that's a fallacy. I've been a periodontist, Randy, for 35 years. And as a periodontist, our first goal, as I've said, is to help people save their teeth.
Okay.
But unfortunately, sometimes it doesn't happen. We can't, it's gone too far. And I use the analogy of a splinter. If you get a splinter in your finger, it gets tender, it gets sore, and all of a sudden you look and you see the splinter when you take the splinter out. Well, that's kind of what happens with gingivitis and periodontal disease. When you remove the tooth, it's like taking the splinter out. There's no reason there.
And the gums get healthy?
The gums get healthy. So that is a good thing for the patient because we need healthy bone to put implants in. So sometimes we do things to the bone to make it healthy, and that gets rid of the gingivitis. And implants don't seem to be affected by gingivitis like teeth do.
Okay.
Teeth are more susceptible. So that is one of the advantages of having dental implants. But as a periodontist, I not only want your natural teeth to be healthy, I want your implants to be healthy. And so there are things we can teach you that's a little bit different than taking care of your
So no
teeth.
matter how bad their gums are, you could work with them once you heal them up.
Well, one of the common things patients say, Randy, is, I bet you've never seen anybody as bad as me.
Oh, they say that to you?
Oh, they say that all the time, and it's almost like a badge of honor. But I tell them, I've been doing this a long time, and one of the things we try to do here is treat people with dignity and respect. And I think that the patient, when they say that, they're actually hurting a little bit. It's a defense mechanism that the patient uses. And so I tell the patient, we're here to help you. I can't say what other people's experience is. I can only deal with what your experience is going to be. And by treating you with dignity and respect and honoring your goals and wishes for this treatment, I find that patients...
So there really are a lot of people that have teeth that are like ready to fall out?
Randy, I go to the baseball game in our town. We have the St. Louis Cardinals, and in this town, that's the #1 thing that everybody goes to. And I go to these Cardinal games, and I see what people are doing. I see them covering their face up, they're not eating this or that, or they smile at you, and it's like, wow, I want to give them my card, and I want to tell them, you can get help. And sometimes it's not me, I just want them to get help. And I know that there's something they can do that's better, but sometimes they don't know, they're afraid they don't have enough money to do it. There's all kinds of fears that patients have, and many times they don't even tell us what those fears are when they first come to see us. We find out later, after they had the treatment, they go, you know, I was really worried about this, and I'm like, it's a shock to me because they were holding back. They were keeping to themselves. Now they're happy. They smile. You see them at the ball game. They're eating a hot dog, and you know it's.
Do you ever run into some of your patients?
I run into
see them eating. Could you eat popcorn, by the way?
Sure. Yeah, you can eat popcorn.
So you can eat whatever you want.
I've had patients come up to me in the street, in the supermarket, and they'll say, "You remember me?"
So no matter how bad your gums are, or your teeth.
Randy, I've seen the worst of the worst.
Is that right?
And those actually are the patients that usually give us the most rewarding feeling when we get back, because they were so far gone that it's horrible. It's just...
So these people don't want dentures that come to you, right? Their teeth, they're sent to you by a lot of general dentists. You work with general dentists all over the place, right?
Yes, we work with a lot of great general dentists.
Their teeth are falling out. They know they don't want dentures, and that's where you come in.
And that's where we come in, is to start that process. And our hope is that we get them before they even get to the dentures. Because once they get to the dentures, sometimes they're comfortable because the teeth have been taken out, but then they find out what's wrong with dentures. You have to wear adhesive. You've got to have them adjusted all the time. Some people have to take them out at night, and their spouse doesn't want to see them without teeth, so they're afraid to take their teeth out, so they hide in the bathroom, take their teeth out.
So no more dentures.
No more dentures. There is no reason in the United States of America that anybody should wear a denture. The denture only is a solution that gives more problems, not less problems. The only thing that's going to solve your problems if you wear dentures is dental implants.
So you walk in, because I think you told me this. You could walk in without teeth, and the day of the procedure, walk out with a full arch of teeth, upper and lower, that don't come in and out.
That's the goal.
Does that happen every once in a while?
No, that happens on a daily basis or weekly basis, depending on what we're seeing. And that, again, is the patient that's the most rewarded. It's like a patient with LASIK surgery. I've been wearing glasses my whole life, and they get their LASIK surgery done and they can see. They don't have to wear glasses anymore. Well, it's kind of that same transformation with patients with implants. They get the implants, the denture's hooked onto it, it doesn't wobble, it doesn't come back and forth. They don't have to worry about going to bed and their spouse seeing them without their teeth. those fears and anxieties are over for the patient. And the patient comes back, and that's when they start telling us, you know, I really didn't want to tell you this at the beginning, but I was really self-conscious about wearing a denture. And when I go to certain events, I would always, you know, have to sneak off to the bathroom. They don't have to do it anymore. Those days are over.